The cartilage that protects the knee joint often breaks down due to disease, injury, and age. This causes the knee to become stiff and painful to move, and when too much cartilage has worn away, patients are left with few options: either manage the pain through injections and therapy or undergo a knee replacement. Knee replacement surgery replaces damaged portions of the knee with artificial implants with the goal of restoring normal movement to the joint and significantly reducing pain. Over 800,000 knee replacement surgeries are performed every year, and that figure is expected to rise to 3.5 million by 2030. Patients considering a knee replacement often have questions and concerns like, how long will the implant last? Will I do harm if I wait to have surgery? How is the surgery actually performed? And when can I return to normal life? So we interviewed 2 board-certified orthopedic surgeons who have performed hundreds of knee replacement surgeries to answer these common questions and more.
A patient doesn't necessarily do harm by waiting to have a total knee replacement. And in fact, our preference is to try to exhaust all of the conservative options before we even consider surgery. So usually that means attempting things like medical interventions, anti-inflammatory medications, cortisone injections, gel injections. There's a variety of non-surgical interventions that we can do prior to surgery, and in many ways can delay surgery until the patient absolutely needs it. By delaying surgery, the patient doesn't necessarily have a worse outcome, but it's just a question of how much pain and dysfunction does that patient want to take on. Now, one thing that can happen in certain scenarios is if the patient waits too long to have a knee replacement, they can have progressive bone loss. And so if you have a situation in which your arthritis is erosive and you're losing bone, that's something that your surgeon may want to intervene on early in order to prevent a more difficult reconstruction down the road. But obviously that comes on a patient-by-patient basis.
I think the best thing that patients can do to prepare themselves for a knee replacement is try a low-impact walking or cycling or swimming program to get them prepared to do the rehab afterwards. In fact, sometimes I'll ask the patient to see a physical therapist and to begin a little program, what we call prehab, in order to prepare them. We try and get them on a good, healthy diet and pretty much ask them the questions that they want answered and try and have them be as comfortable with the process as possible.
Surgical details vary by procedure and component design. Some procedures involve computer-assisted 3D imaging and micro-robotic instruments to aid in removing damaged parts of the joint, while other procedures use manual instruments with precision guides. An incision will be made on the midline at the front of your knee. Minimally invasive procedures use a 4 to 6 inch incision, whereas open procedures, as shown here, traditionally require a 7 to 10 inch incision. Next, the surgeon accesses the joint. The patella is moved to the side to provide access to the femur and tibia, and any bony outgrowths along the margins are removed, as are the menisci between the femur and tibia, the anterior cruciate ligament, and the posterior cruciate ligament in procedures where the PCL is not spared. Cutting blocks or guides are fixed to the femoral condyles. Retractors hold tissue away from the joint and protect the collateral ligaments and patellar tendon when the bones are cut. Using the guides, the surgeon makes precise cuts to remove degenerative portions of the femur and sculpt the ends to accept the femoral prosthesis. Next, a tibial guide is positioned to accurately remove a small portion of the tibial surface. If the patella needs resurfacing, a series of similar steps are used to remove the damaged portion and prepare for the implant. For tibial components that involve a stem, the channel in which the stem inserts into the tibia is now created. Next, the permanent femoral, patellar, and tibial prostheses are positioned and secured in place, and any excess material is removed. The bearing surface is affixed to the tibial plate to complete the repair. Finally, the various layers of tissue are repaired with dissolvable sutures, and the skin incision is closed with sutures or surgical staples. A bandage will be wrapped around your knee and you will be taken to recovery.
A modern total knee replacement should last 20 years. We have very good decades-long proven survivorship showing 20-year survivorship rates now cresting beyond 90%. Obviously, there are a lot of factors that contribute to longevity, certainly patient-related factors, implant-related factors. Sometimes there are certain factors that are outside of the patient's control, but generally speaking, there is very good data now showing you have at least a 90% chance or greater of lasting 20 years with your implant.
After surgery, knee replacement or hip replacement, the patient can expect to start therapy on the day of surgery. And the exercises typically are not very complicated, but after the operation, there is discomfort and pain, and so we work with the patients during that initial period to get them comfortable so they can comply with the necessary rehab program. Typically, patients will be in a walker for 10 to 14 days unless they have other problems or other joint problems that are present. Sometimes they'll have to be in the walker a little longer. They typically can bear weight right from the beginning, full weight. Stationary bike exercises can start as early as 3 weeks. Pool exercises, 3 or 4 weeks. And then it's a gradual progression that really is patient specific. Some patients will move along the timeline a little more quickly than others, but we individualize the postoperative care for each patient. We get a lot of questions now about pickleball. It used to be golf and tennis, but now pickleball is the question. And for hip replacements, it's usually probably 8 weeks before I feel comfortable letting them do that, and 8 to 10 weeks for a knee replacement. It's pretty similar for golf.
Visit understandortho.com to watch medical animations and physician interviews about a wide range of orthopedic conditions, treatments, and surgery.